Hello, my name is jason.oko. I'm a firefighter and paramedic with the Corinth Fire Department. And today we're going to walk you through our presentation regarding our proposal to the Select Board of the Town of Corinth to continue EMS coverage in the Town of Corinth for the next 6 months. In this video, we'll talk about what are the upcoming changes to the way EMS is being handled in Corinth mean. We'll talk a little bit about what EMS is, what our available options are, how much will this all cost, and what we're doing to get ready for the future. So the first thing I want to point out is on the screen there is a timer and it says 22 and a half minutes. That is the median response time from the town of Dover coming to the town of Corinth. With that, what does that mean? That means when you call 911 and they triage your phone call, they'll page the ambulance, they'll notify the ambulance. From that point in time to they arrive on scene, the median response time from Dover Foxcroft to the town of Corinth is 22 and a half minutes for the last year. From the Dexter base, that time is 25 minutes. When Corinth responds to calls from the Corinth base, when it was Mayo ambulance, it was 9.5 minutes. Response times don't always matter, but occasionally they do. There are some EMS incidents, which a friend of mine once affectionately referred to as unscheduled primary care. Those types of calls, time may not be such a critical factor, but there are other types of calls that time is of the essence. Some of those types of calls are when you're experiencing chest pain, when you're experiencing difficulty breathing, when you are bleeding and it can't be controlled, or when someone you love has an altered level of consciousness that is unexplained. Those are when response times matter. So let's talk a little bit about what EMS is. EMS is a system. When you call 911, a 911 dispatcher, an emergency medical dispatcher who is trained and licensed by the state of Maine to provide that service, will triage your call. They will dispatch an ambulance to your home. An ambulance will respond directly to your home or your location. They'll pick you up and if necessary, they'll transport you to a hospital. Once you're at that hospital, the hospital will treat you and stabilize you. And if you need to go to another hospital or to another facility, an ambulance can take you from that hospital to another facility, or a helicopter will take you, depending on the seriousness of your condition, and take you to another hospital. Some numbers for you. This is the Northern Light Mayo call volume by year for the last 6 years, 2024 to date, last total of 5 years. And they've seen some steady call volume. 2020 was a down year. That was COVID-19 related in April of 2020. EMS call volume fell through the floor a little bit. So to see that we're in September of 2024 and we're about 900 calls off from where we were for the entire year of 2020, they still have some time. This is an average of 5,000 and right around 5,000 calls a year that they're doing with these numbers here. And they'll have 3 bases operating. They'll have 3 bases operating. 1 ambulance stationed in Dexter and 2 stationed in Dover Foxcroft. That works out to 14 calls per day that they'll be covering from those 2 bases. And all these areas that are in blue are their primary coverage area. We've highlighted Dover in red and Corinth in red because those are the 2 towns that we want to talk about the most. But those towns that are in yellow are also towns that they regularly provide coverage to as well for mutual aid. So the plan moving forward right now for Northern Light Mayo Hospital EMS service is to cover the calls in Corinth, in Exeter, and Garland, and Charleston, and Bradford, and Corinna, and all these other towns out of the Dexter base or the Dover base. So EMS has 3 license levels that we're going to talk to you about today. First license level is emergency medical technician. The reason we're talking about these license levels is because these are the license levels that can transport a patient in the state of Maine. An EMT can provide basic life support. They provide essential pre-hospital care, CPR, basic airway management, and they can use an automated external defibrillator or an AED. They conduct patient assessments, and they have a limited array of medications and other procedures that they can perform. There are advanced EMTs. They have some intermediate skills that build on the EMT skill set with some additional training and some more advanced procedures. They can do advanced airway management. They can do what's called a blind airway insertion, which is slightly more secure than the BLS measures that an EMT can do. They can place IVs, and they can start administering fluids and a few medications. And they have some expanded medications that they can administer. Some of those medications are IV, administered through an IV. Then we have paramedics. Paramedic is the highest level EMS clinician you can get on an ambulance call in the state of Maine. They offer advanced life support, the highest level of pre-hospital care. They do comprehensive assessments along with performing and diagnosing a 12-lead EKG. They can do advanced procedures. They can do what's called intubation, which is the most secure form of airway management, as well as surgical airways if needed, and they can decompress a chest if needed, which is a life-saving therapy. And they can administer all the medications that are carried in the state of Maine. Give you an idea about the Corinth Fire Department staffing, we currently have 3 emergency medical technicians, 5 advanced EMTs, 2 are in school right now. Their classes will wrap up in December to become paramedics. We have 6 licensed paramedics right now, soon to be 8. And we have 2 licensed ambulance operators. So this is our community. These are the patient. This community is the patients that the firefighters and paramedics of the Corinth Fire Department strive to serve. We used to be a farming community. There are several farms in town. There's still some farmland in town, but largely now we're a bedroom community. And we can show that we have a growing population in town. In 2014, we had 2,854 residents. We saw, we saw a little dip for a few years. Then in 2019, our population went up by 96 residents and has continued to go up to 3,055 in 2024. To give you an idea, the median household income was $55,250 in the town of Corinth, and 6.1% of Corinth families live below the poverty line. And this is an idea of what the poverty line is considered based on the family size. So what are our options? We have 2 options. We have option A and option B. Option A is we ride the wave. We do nothing. We allow Northern Light Mayo to respond to Corinth from Dover, Foxcroft, and Dexter with a median response time somewhere between 22.5 minutes to 25 minutes. And as you can note on that timer, we're less than 10 minutes into this video. And we have 13.5 minutes left before an ambulance gets here. Option B is the Corinth Fire Department EMS staffing proposal. We were looking for October 1st, 2024 through March 31st, 2025 with total staff days of 182 days, and the price tag would be $150,000. This is how this breaks down. You'd have one EMS clinician 24 hours a day at a pay rate of $15 an hour on restricted call wages, one EMS vehicle operator at a minimum 24 hours a day at $15 an hour on restricted call wages. The total of that part of the plan is $131,040. Part two of that is part one is the cost of readiness. That ensures that there's staff here in town that are ready to take an ambulance call. When they do go on a call, we're going to increase their pay to $20 an hour. So an additional $5 an hour while they're on a call. We average approximately 1.5 calls a day. Sometimes those calls happen. We'll have 3, 4, 5 calls in a day, and the next day we won't have any calls, but it averages out to about 1.5 calls per day, which works out to about an extra $10,920. So we're at $141,960. There's some payroll taxes and workers' comp insurance that are included in that. Part right around to $8,000 brings up to the total to $150,000. And that would get us through the next 6 months. And the obvious question to me is, what do we do after these 6 months? And I got to be honest with you, we're not sure right now what we do after that. We are looking towards the future and trying to see what the next 5 years look like. And we have are in the process of forming a strategic planning committee to build a vision of what we can do to collaborate with some of our partners, what we can do to get some grants. There is the Assistance to Firefighters Grant Program. That grant program has the primary goal of assisting firefighters to meet firefighting and emergency response needs of fire departments and non-affiliated emergency medical service organizations. There's SAFER grants. SAFER grants are the Staffing for Adequate Fire and Emergency Response grants. The goal is to enhance local fire departments' abilities to comply with staffing, response, and operational standards. These grants open late in the year, and awards are typically announced in August. So we expect these grants to open in October, November, or December, and we're going to put in for some of these grants to get some funding. But the grant awards won't be announced until August. As you can see, the AFG grant awarded $289.2 million last year, and the SAFER grants awarded $215 million last year. We're collaborating with our partner communities. We're talking with the towns of Glenburn and the towns of Canduskeg and Corinth, obviously. We have a strategic vision of putting an ambulance in Canduskeg that would be staffed 24/7 to respond to Corinth, Canduskeg, and to Glenburn because it's centrally located. And we have an ambulance and a fly car in Corinth. A fly car is a first response vehicle that can respond initially, and an ambulance and a fly car in Glenburn, with the primary response coming out of Canduskeg and these 2 ambulances as a reserve ambulance. So thank you for listening. There is a special town meeting on October 22nd, 2024. Details will come. Please pay attention to the Corinth Fire Department Facebook page, and please pay attention to the Town of Corinth Facebook page for additional details on that. And thank you for watching.